Okay, so I think we'll kick off. It's 1 o'clock, so I think we can safely start. So welcome to you all. This is the first time that we've run this mentoring series for our rural partners, and we're, I think, really excited about this particular program because, as you know, we've been running beginners courses and also advanced courses for clinical supervisors. And what we do know from the research is that once-off educational interventions are not necessarily effective, and actually it's an ongoing dialogue, and it's the chance for you to let the ideas marinate and also to give you a chance to translate some of those ideas into practice that really makes a difference. So I'd like to welcome you for this particular session, and my job is to talk about feedback in the clinical workplace, which is doesn't really feel like a job for me because it's an area that I feel very passionate about, and I've spent about 15 years studying feedback processes in the health workplace. So the way that this session is going to go, obviously we have you online. It's not as interactive as it would be if we were in the one room, but what we do have is the chat function set up. So if you have urgent questions or ideas or challenges, please do use that chat function. And I'm going to make sure that at 1:45 we pause and we'll have that 15 minutes for discussion and challenges. And particularly I would like you to think about how these ideas resonate with you and with your current practice. And the other thing I'd like to prime you for in this session is to think about just one thing that you're going to translate into your workplace that you think will make a difference when it comes to feedback. So I would like to acknowledge my colleagues and certainly Michelle Curtis, who's on the end here on the line. So the Excellence in Clinical Teaching Program Excite team. So we teach a series of postgraduate courses, a grad cert in health professions education, a grad dip in health professions education, and also a master's in clinical education. As well as that, we run these short courses and now the mentoring programs for our partners. So if you feel tickled by this material and you think that you want to extend your capacity as an educator or a leader or an educational scholar when it comes to clinical education, please do go to our website or email us and maybe think about extending this into formal postgraduate coursework. So thanks again to Michelle for setting this up, and I'd also like to acknowledge my research colleagues, David Bowd, Christina Johnson, Margaret Bierman, Damien Castanelli, and also Jennifer Weller, who've been involved in this work. So what we see, I'm going to give you a moment just to read this particular cartoon. So the reason I put that up is that so often in the left pane, you can see quite a typical script that we see when it comes to feedback. And that is that there's a generic sort of, you've been a pretty good horse comment, then a little bit of criticism, and then there's going to be some sort of flattery or good feeling to finish off with. And that's quite a characteristic rhythm or script that we tend to see in feedback. Then what we see in the right-hand pane is this sense that whenever two creatures or two people are in conversation, we cannot assume that there's shared understanding. And you can see here the horse is actually not after feedback, they're after feedbag. So I'd really urge you to think about any sort of feedback or learning discussion to not make the assumption that both parties have a shared understanding. And to me, it highlights the importance that when you have any discussion, you ask at the end or as you're going to get a sense of what the learner is picking up from that discussion. So what we see in that script is what certainly we've seen in our research on feedback in the workplace, and that is the sense that feedback is seen as something that the educator does to the learner. And we had Kneebone, a cartoonist, sit in on one of our research days when we were looking at this data, and he painted this cartoon with this idea of the educator setting sail of the cannonball and the cannonball sort of doing the work and perhaps harming the learner. So very much a one-way street, and we want to try to move away or shift our practice when it comes to feedback. So you'll all have, I suppose, different learning needs when it comes to feedback in your workplace, and it might be in terms of working with students, it might be working with your peers, it might be around feedback to patients. So just thinking about your particular context. And here are some learning outcomes that I prepared earlier. So I'd like for us to discuss why feedback conversations can be so challenging, and to debate and extend ideas about what feedback is. And I think if you ask students, but also teachers, both in the workplace and in the classroom, most people tend to see feedback as information that a teacher gives to a student. And I'm going to try to challenge you to think more broadly about that definition. We'll talk about the role of the sensitive and constructive feedback process in promoting learner evaluative judgment. And essentially what I mean by that is that often we know from the research the effect that feedback can have on clinical performance, but also if you conduct feedback in a, welcome to Elizabeth, if you conduct feedback in a dialogic way, what you're also doing is asking the learner to commit their own judgment about how they're performing. And if you then marry that with your own judgment, you've got what we call a calibration process going on. So this style of feedback can actually build people's ability to self-evaluate. And ultimately, as you know, that's what we want for our independent practitioners in the workplace. And finally, I want to talk about the role of what I call design when it comes to effective feedback. And that is that we don't see feedback as an episode or as just a conversation, but we're really mindful of feedback as a process that happens over time and that has an effect. So hold on to that point where we say that feedback is not feedback unless it has an effect. Okay. And of course, I've got one additional objective, which I've written about quite a bit, and that is to get rid of the feedback sandwich, often known as some sort of other sandwich as well. And the reason I don't like this, and we see this playing out in all sorts of contexts, both in higher education and particularly in the healthcare context. And what the feedback sandwich is that idea of some praise and then an uppercut. You hit them in the middle with something constructive and then finishing off with praise at the end. And the reason I don't like that as a model is that first of all, our learners become very savvy to that particular model and they anticipate it. So if you do give them some sort of validating feedback information, they tend to think it's tokenistic. And often it's actually very difficult to decipher what the messages are because the key message in the middle is actually disguised. The third reason I don't like the feedback sandwich is that it's something that the chef prepares and says to the learner, eat this thing. So it's pre-constructed and it's the idea that the learner can then digest that material, which is quite different from saying, let's construct something together that has some sort of nutritional quality that's going to improve your learning. So if you catch yourself giving a feedback sandwich, give yourself an electric shock and perhaps think about an alternative way of approaching feedback. Okay, so the very purpose of a feedback sandwich is trying to diminish the emotion as part of feedback. And we're just writing a book at the moment, Rolla Rajawi and Christy Noble and I are writing a chapter in this book about emotion as being part of the feedback process rather than seeing emotion as something that is like a form of static that you want to remove in order to get the message through. And I think it's a real shame because when you think about learning, emotion is very much embedded as part of learning. And in fact, it has a really strong mobilising function. So if you want to motivate people to change their behaviour, then you want them to invest emotionally and cognitively with that particular goal and with the behaviour change. So that's something that we're working on, is trying to get both learners and educators to understand that emotion is a necessary part of feedback and not to have these sort of compensatory models that try to swipe emotion out of the way. So inherently feedback is an emotional business, and we know that it can invoke an emotional response during a conversation, and a lot of us have got a couple of juicy stories that we could recount, but also there's this idea of the emotional legacy. And Andy and colleagues in 1995 wrote about this idea of feedback having a long-lasting impact beyond its original intent. We see that in terms of people's career choices. Sometimes people remove themselves from environments, and certainly can affect career choices as well. So one way that I like to think about this idea of emotion and the intersection with learning is to think about the two dimensions. And here you've got, on the x-axis here, you've got the degree of challenge that you're trying to promote within the learner. So if you're trying to get someone to change their behaviour, that would be a high challenge. On the y-axis, you've got the degree of support or emotional support that you're providing for the learner in order to enact that particular change. And what we see in the literature is this notion of vanishing feedback. And this is actually much more prevalent than the destructive feedback that I spoke about before. And vanishing feedback is essentially this notion that we are so concerned about the emotional well-being of the recipient that the message itself vanishes. So, or another way to think about it is that we're walking on eggshells and that we're not constructive about what the message that we want to co-construct with our learner. So that's what we call vanishing feedback. And if you want to look at the original source, Andy in 1983 wrote about this concept, and David Bowd and I have written about the notion of mealy-mouthed feedback. So the extreme to that is the damaging feedback. So that is when there's a high challenge to the learner, but not the emotional support. And you can see there Dawson from Dawson's Creek is suffering with some confronting feedback from Katie Holmes. So that also has an inhibitory effect on learning, just as vanishing feedback does. So you can imagine if we're aiming for optimal practice, we're wanting to look at that upper right-hand quadrant with high support and high challenge. Okay, so what I want you to do, and I know there's a couple of people, I think, in the room together. So if you are with a colleague, feel free to do this verbally. But if you are by yourself, I'd like you just to spend 2 minutes to think about an emotional experience in feedback where you've been the recipient of feedback. And I want you to think about what was it about that feedback encounter that made it feel emotional, and in fact, what were the emotions? So I'm just going to give you a couple of minutes to jot down that particular scenario. Okay, so just bearing in mind your particular episode and what you think made that productive or unproductive in terms of your feedback experiences, I'm just going to show you a little bit of literature out there around feedback and what makes it effective. So in terms of what is feedback, full stop, there's lots of different definitions, and the one that we've worked with in our research is the following. So we say that feedback is a process whereby learners obtain information about their work in order to appreciate the similarities and differences between the appropriate standards for any given work and the qualities of the work itself in order to generate improved work. So this is slightly different from the idea of feedback is information given from teacher to student. And you can pluck out the particular words that I suppose betray the difference in this definition, and that is that we say feedback is a process. So it's something that happens over time. It's not a once-off thing. It also, the stance is quite different. So we're saying that feedback is a process where learners will seek information about their work in order to sense make and then enact something different. So there's this idea that they're making a judgment between the standards or the goal of good work and the work itself. And they do that process of sense making in order to generate improved work. So this is where we've got that idea of feedback is not feedback unless it has an effect. And of course, if you imagine your own feedback experiences and perhaps what we do on a day-to-day basis within the healthcare system is often we don't trace the effect of feedback. We don't actually trace whether the feedback conversation has had an effect on people's performance. So if we could turn back to the literature, we know that more than any other variable in education that feedback has a key effect on learning. So it can be potent, but it rarely is because we're not using it to its capacity. We know from the literature that it's hard to give and it's also hard to take. And we'll talk about that idea about why feedback can sometimes be confronting from a recipient's point of view. So we know from the higher education literature that learners find feedback one of the most problematic aspects of the student experience. And this is not native to Victoria, this is not native to Australia, this is a worldwide phenomenon, and universities around the globe are investing a lot of money into fixing this feedback problem. So learners complain that they don't get enough feedback, and when they do get it, they can't use it. And also both learners and educators find it confronting. And this is important to remember, and I think it's in line with a lot of these workshops that we're running with clinical supervisors, is that supervisors really do find the process quite challenging. Collecting the data through direct observation, making judgments, having the pressure of being the sole evaluator of a learner's performance, and then perhaps communicating that sensitive information. So this is a sticky and tricky process for both parties. Fernando and colleagues back in 2008 did an observational study in medical education, and they found that almost 50% of feedback within medical education didn't include a specific action plan. And this resonates with my own PhD study, which I'll show you in a moment. And most concerning, I think, is this final point that educators typically think their feedback is more useful than what learners think. So perhaps we should be getting some feedback on our feedback. So my PhD was in physiotherapy education, and I videotaped formal feedback sessions at the halfway point and the end point of a placement. And what we found is that the average time for feedback sessions was around 20 minutes, and the average time for learner input was about a minute within that 20 minutes. So the learner only contributed to about 5% of the conversation. And there was a real sense of tokenism that educators knew that it should be a two-way dialogue, and they did extend an invitation for the learner to self-evaluate, like something like, you know, Michelle, I'm really keen to hear how you think you're going. But Michelle would give quite a superficial response about how she's tracking, and then the educator would launch back into the monologue. So, you know, this idea that just like if you saw a colleague in the corridor and you're in a rush and you say, how are you? You're not necessarily expecting that detailed rundown of someone's health. The other thing we saw, so I suppose that to me is diagnostic, that feedback is a ritual and both parties are complicit within that ritual. The other thing we saw, both through the video data, but also through the interviews of both parties, was that there was a real sense that the clinical educator was seen as a diagnostician of the learner's performance. And when we interpreted this data, we really saw this as a hangover from the clinician's role with patients, and that is that they collect data about the patient and they make a diagnosis about their health or their condition. So almost a paternalistic viewpoint where the educator thinks that their job is to make a learning diagnosis, then communicate that to the learner and fix the learner. And that makes sense when you look at that pattern of interaction, where feedback here is really an act of telling. So we clearly have a problem when it comes to feedback. And, you know, this study that I did was back in 2006. I've got a colleague, Christina Johnson, who's doing a PhD currently looking at feedback right across the health professions. And her patterns in her observational data are very similar. So the practices aren't necessarily changing. So we've got a problem, and how do we fix this problem? Well, we could say the same thing, but say the message louder, or we could flip it on its head and look at the problem from another point of view. And it's not a new point of view, it's actually a very old point of view. And this is actually thinking about what is the very genesis of feedback when you look at something like engineering, or when you look at biology around homeostasis. And I mean, I think the common thermostat is a really good example of a feedback loop, where you have a standard or a set point where you want the temperature to be. Then you have an input, which would say this room is actually not 18 degrees, it's only 10 degrees. And then there's an output, which is a blast of hot air. And the process doesn't stop at that point. It keeps going to modulate that temperature to hit the set point. And that's the way a feedback loop is designed. But in education, we've sort of perverted this construct, and instead we're thinking that feedback is just an input. So just like saying this room is not 18 degrees, and then we wonder why learners can't pick up that information and change their performance. So I think two things that I'd love you to take home on this particular point is that feedback is more than telling. And it also does not end in telling. So I think so often after we've had a conversation, we think our job is done, but our job is not done, because we need to set up another occasion for the learner to translate that information into practice, and we need to close that loop as well. Okay, so I'm going to pause there just for a moment, and in your chat box, so you'll all see that there's a chat function on your screen. If you can, I'd just like you to write down one piece of information or one point that is resonating with you so far. Just checking that you're not asleep. All right, here we go. So yeah, so Beck here has said it's okay to acknowledge the emotional aspects of feedback. And then Anne has said it's resonating that the research is showing what a one-way street feedback is. Yep, fabulous. So I think, you know, the top point about the emotional aspects of feedback, when I've been sort of marching around the country teaching health professional students about feedback literacy. And part of that program is actually acknowledging the role that emotion plays and getting them to think about why they feel defensive or why they feel worried. And also getting that sense that just because you don't feel good when you get the information doesn't mean that it's not good for you. And often when we do get a disconnect between our own self-evaluation and another person's evaluation, that's where we get the most potent gains in terms of changing our frames and also changing our behaviours. And we've got here, Anne says here, is feedback required for feedback's sake? It becomes white noise. So I suppose I'm not quite sure, Anne, around that point. is that about this sort of tokenistic ritual that if you perform a task, you'll get feedback, but perhaps it's not the right time, or perhaps that it's not relevant to the learner. So I think, I mean, certainly from my research, that's one of the biggest things that we've discovered, that if you get feedback or feedback information related to a particular aspect of your performance that you're worried about, that has so much more resonance and traction compared to when someone gives you unsolicited feedback on an area that perhaps you're not as concerned about or worried about. So we should absolutely not just be going through rituals for ritual's sake, but thinking very much about the purpose of why we're engaging in these processes. So thank you to everybody. Okay, so if we're thinking about good feedback practice, we certainly want to think about, and this goes to that very point, that the information is orientated to the learner's needs or goals. And I'll give you a really simple example. I have about 10 PhD students at the moment, and when they send me a piece of work via email, they'll attach, let's say, a book chapter, and they'll say, "Dear Liz, here's my chapter. These are the points that I'm worried about and that I'd like feedback on," and they detail those things. And then what happens when I read that chapter, I am giving them feedback that is relating to those concerns, and I might find some other points within that chapter that I also want to comment on. But it means that they get really tailored information and it matters to them. So we want it to be based on observed behaviour and not on someone's personality or qualities. And when you think about when people get defensive about feedback, it's often because they're getting information about a so-called static quality, like, for example, whether they're respectful or not. It's quite different from observed behaviour. We also want feedback to be specific and pointy. And if you catch yourself in the next week, the way that you give feedback to colleagues, catch yourself the number of times you say things like, "Good work, you're doing a good job, you're on the right track," and think about what is that actually doing to help the learner progress their performance or their understanding of their performance. So we want feedback to be pithy and specific so people can pick up that information and do something with it. The other thing we know is that we want feedback to be compared to an explicit standard or target of work. And if you saw from that definition, we really want the learner to sense make about how their own work stacks up to that standard. What is really interesting to me is that in a couple of studies, we have found, feedback studies, we have found that supervisors that are good at giving feedback spend more time talking about what good work looks like than they do diagnosing the learner's performance. And something quite mysterious happens, that when the learner understands the target, then often they can join the dots about how their performance stacks up to that target. And that is often much more empowering for the learner than to be told what's going wrong. The next point is about feedback being based on the explicit aim of performance improvement. And this sounds like a no-brainer. It doesn't sound like rocket science, but it's amazing, I think, how often people forget. So often people think that feedback is punitive or they're going to get wrapped over the knuckles. And I think sometimes having that discussion about, we're going to have a difficult conversation, or you might find this difficult to hear, but I really think this is going to help you on your performance trajectory. And that just reminds people that this is about development and not about sort of punitive results or punitive functions. And I think most important, and the thing that is most lacking from feedback practice that I've observed, is that we need to follow up a conversation with a plan to re-observe a similar task. Because if you don't have that next step, there is no way to actually close the loop. All right, so I want to talk about two feedback models that you might want to use in your clinical practice and in your supervisory practice. And the first one we write about well, is actually ground zero, and that is feedback mark 0. And this is what we most commonly see in practice. That is hopefully useful information that is provided to receivers, and it's done on completion of learners' work. And we say hopefully because hope is all we have here. We don't actually know whether that information has an effect. So feedback mark 1 is an improvement on that mark 0 model. And that is, it goes back to that very sort of thermostat concept that feedback is a system of both inputs and outputs. So you can see here in the blue, you've got activity 1, then you've got the educator providing information to the student in order for them to improve activity 2. And then they get feedback on activity 2 that they can then hopefully translate into activity 3. So it's still transmissive, it's still very much a didactic transference of information from the teacher to the learner, but it is an improvement on mark 0 because we are giving the learner a chance to enact that information. The advantage is the learner gets to see the effect, and hopefully activity 2 will improve on the basis of the information. But the other thing that it does for you as an educator is that it helps you actually calibrate the quality of your feedback. So if your learner embarks on activity 2 and they do not improve their performance, you get a feedback loop that tells you that your feedback information was ineffective. And the next time you engage in a feedback exchange with that particular learner, you will hopefully change the way that you, the conditions you set up or the way that you communicate that information. So that's what we call feedback mark 1. And it only works if there's some sort of degree of overlap between the activities. That is, if you set activity 1, have a feedback discussion, and then have activity 2 that bears no relationship to the first activity, there is no opportunity for the learner to translate that learning into practice. So there needs to be some sort of overlap of learning outcomes. And this becomes a little bit more tricky in your environment, and that is the messy world of clinical practice when you can't necessarily control the next patient that comes in the door and what pathology they're presenting with. So if you like, the sequencing of these activities can be a little bit more tricky compared to our job here in the classroom when we're working with first year medical students. All right, so we say that model of feedback mark 1 would be all good and well if we were working with machines, and that is that our students would be like machines that respond predictably and reliably to the information we give them. But we know that's not the case. We know that learners will come in with different preferences, with different learning needs, with different goals in their clinical setting, and you'll have a different relationship with those learners, and that will have a very strong impact on the way that feedback is enacted or taken up and then put into practice. So feedback mark 2 accounts for this very idea that we're human. And it goes like this. So I think this is really one of the keystones that I'd like you to take away from today is the value of thinking about these particular principles when you engage in any feedback discussion with any sort of learner. And that is that there is a clear orientation to the standards of work, so what the learner's aiming to do, but also there is a reminder or an orientation that this is the purpose of feedback. Then there's similar activities to before. You've got activity 1 and activity 2 that are linked in some way and enable the learner to have a crack at something, have a performance discussion, and have another crack at a similar related activity. But the difference here is that we privilege the learner as someone with volition who has an ability to make judgments about the quality of their own work. So we ask the learner to judge their work. And not only do we ask them to judge their work, but we also ask them, what specific feedback do you want on that work? And this particular point here can even come before the task. So you could get a learner that is about to, for example, take a history of a patient with Parkinson's disease and says to you, Anne, I would like you to watch for A and B in this particular interaction with the patient. So if you like, they're priming you for what they want feedback on. Then the other judges the work. And we say other and not teacher because we are trying to acknowledge that a feedback source could be a teacher, it could be a colleague, it could be a junior colleague, it could be a patient, it could be one of the nursing staff. And that different people have different perspectives and will comment on different aspects of work depending on where they're coming from. So the student judges their own work, the other judges their work, and then the student has the difficult job of comparing that judgment. They need to think about, this is where I think I'm at, this is where the teacher thinks I'm at, are they the same, are they disparate? And if they're disparate, what am I going to take forward in my practice? So that's where we have the planning phase where the learner and the other will have a conversation about what does this mean for your practice and when are you going to get another chance to enact a similar sort of performance to enable that translation. And the whole thing we call Feedback Mark II. We've been testing this. We've been teaching our clinical supervisors this model, and we've also been teaching our learners how to engage with this with this particular model. So I'm hoping that if you're not using it already, that you might find some aspects useful in your own practice. So really, I think one of the key tenets to this model that we're talking about today is that it really takes feedback into the hands of the learner, and they see feedback as a tool for them rather than a destabilising or debilitating act that's done to them by those in authority. And I think that just changes the sense of empowerment of the learner, and they understand that this is not a punitive act, but in fact, it's a process that is designed to improve their learning, even if that feels uncomfortable at the time. So hopefully, if we upskill you guys to create these conditions within the clinical environment, and if we upskill our learners from day dot how to do this dance, then hopefully when we ask learners to have input into their own feedback discussions, it becomes just a habit like brushing your teeth rather than an act of bravery when someone asks the learner, how do you think you're going in this particular placement? So that's really the aim. So just, I suppose, to finish off, I just want to reinforce that idea of emotion being part of feedback, and that, of course, when we look at a stress performance curve, we know that if people have too much arousal or too much stimulation, that does impact their cognitive load. So we are aware of that, and we often choose our timing of our feedback interactions based on those sort of judgments. But essentially, we know that if emotion is mobilised and accounted for, we can get better effects than trying to disguise it. We do sometimes see what we call maladaptive responses to external feedback, and that is often what we call the activation of the psychological immune system. And that is that as humans, we all have a psychological immune system. We have a filter, and we let some things through that net, and we don't let other things through the net. And we do that to, if you like, to protect ourselves. And unfortunately, some learners, for a number of reasons, will have a very well-developed psychological immune system, which means they always privilege their self-evaluation and they bump any sort of incoming data that comes their way. Now, why we do that, I suppose, or why people get so emotional around feedback conversations is that we tend to have a view of how we operate in the world. And we quite like a constancy of that view. Even across contexts, we like to think we're a certain person with certain values. And if you get data from a supervisor or from a peer or from a patient that challenges that particular viewpoint, it can cause turbulence and certainly stormy seas. And in a way, sometimes we want to leverage off that and leverage off that discomfort as a way to motivate behaviour change. But also sometimes we want to coach people that it's okay to sit with that discomfort, and that over time that discomfort might be converted to commitments to change the way that they go about their business. So we know that feedback is best when it occurs in a respectful and trusting relationship. And, you know, this is quite a woolly construct. It's very difficult to say what makes a trusting relationship. And it's also very difficult to establish a trusting relationship if you have short, rapid placements where you just don't get to know someone well. But we do know that if a feedback source is perceived as credible in terms of their clinical practice or their educational know-how, and if they're perceived as well-intentioned, then you're more likely to listen to the feedback message. We know we need to think about focusing on behaviour rather than people's traits, and that sort of helps to reduce that threat to people's identity. We want it to be really targeted and pointy so it's meaningful to the recipient. We always want to bang on about the fact that feedback is about improvement. And I suppose the other thing is that if we do these processes, if we enact these processes enough, they should become second nature and just part of routine practice rather than something to anticipate or to get sweaty underarms about or to fear. And that's that idea of making this or embedding this as part of clinical education. So I'm going to just a quick point on that idea of how you create trust and psychological safety when it comes to feedback. The one thing that we've found in our data around feedback is that if educators are vulnerable about their own practice, and if they are disclosing what they struggled with or what they still struggle with, then learners are more likely to be candid about where they see their performance deficits. And that's when you get really good transformative learning conversations. If both parties are trying to show their best shiny selves, then we don't get an airing of deficits or what's troubling or what people are finding difficult, and that makes it really hard to build on strategies to improve performance and learning strategies. So if you're interested in this idea of intellectual candour and what you can do, I suppose, with your peers and your learners to try to create that psychological safety, this is a paper that we published last year in Medical Education. Okay, so I'm going to bring it down to here. So typically, you might see some people give presentations and tell you a summary of what you need to take on board in your own practice, but I would like you to be candid and to talk about what you'd like to take, I suppose, what's rattling around in your mind and one or two things that you want to take forward in your feedback practice based on today's discussion. All right, so Anne says, I've been here with Helen and Mary. We've loved your presentation, in particular the concept of having the student target their own specific feedback. Yeah, I think for me, this has been the biggest change in my own feedback practice. I think it doesn't take much more time, but just before you go and observe somebody do a particular task, asking them, you know, what's the one thing you'd like me to focus on today, I think reaps big benefits. So I think that would be fantastic if you give that a go. Beck here has said, we're thinking that as part of our process of orientating students to the placement, we'll introduce the Mark II feedback model. Make it clear from the start how we'll be approaching feedback. Yep, I think it's super. And, you know, in a way too, rather than you could dictate that and say, this is how we do it around here, or you could also try to think about that two-way model even in the way that you come to your ground rules. So you could say, you know, what's been your experience of feedback, what tends to work for you, and try to get them to sort of have input into the sort of culture of feedback that you want to establish, and then certainly you could give them the tenets of the feedback model, and so I suppose you're literally working off the same page. So I think that sounds exciting. Okay, what I would like to show you in the name of feedback, and so Michelle Curtis does not get grumpy with me, just a reminder that if you're going to extend or continue to build on your expertise as a clinical educator, we've still got applications open for our April and September intensive intakes for the grad cert in clinical teaching. You know, it's a 12-month program, and we see really good gains in our graduates that go out and, I suppose, pollute the workplace, pollute their peers, and have a great impact on their students. So I would encourage you to come and sign up. And in the name of feedback on the feedback, it's really important to us to evaluate how you're finding these mentoring sessions. So what you do here is you open your iPhone, open the camera, and then you just hold the camera up to the screen, and you'll see a QR code up the top of your phone. Press on that, and that will take you to a Qualtrics online survey that's super quick, that just gives us some feedback about how useful you found this particular session. So I'm just going to give you a couple of minutes to fill that out, and then I'll ask you one more question at the end. All right, so just the final thing is to say good luck with your feedback dialogue. You know, I always say, don't believe what I say, give it a go and trace the effect yourself. And I think if you're curious and you've got that playfulness around experimenting with these techniques, you can really see what the impact is. The second thing I'd say is, it's like any sort of professional development. You do a course or you go to a lunchtime webinar, you get all fired up with what you're going to do, and then you get busy and under pressure. And when we get under pressure, we tend to revert back to our default practices. So I would encourage you just to cleave off a little bit of extra time, or if you're going to have a formal feedback discussion, perhaps give yourself some cues about how you're going to structure that discussion, just so that you support the change in your own feedback practice. So all the best with that. I've got references here that we can also send you these, and just some added resources for you. There's two websites, one around assessment and one around feedback for learning. And also you can follow us on Twitter as well. So thank you to everybody. Thanks for participating, and hopefully we've made the session as interactive as possible using that chat function.